Welcome to the Mental Path Podcast. I'm Dr. Gretchen Gavero, a psychiatrist and therapist, and I love combining psychology, medical knowledge, and personal growth tools to support my mental health. In this podcast, I will share insights and skills I use to build resilience so you can find ways to help yourself think and feel better. Last week, I shared different ways to spark and sustain motivation. With life's up and downs, we all have times when motivation is short of where we want it to be. It could be because of physiological reasons like fatigue or illness, or it might stem from feeling sad. Feeling positive or negative emotions in the proper context and with reasonable intensity is a natural response. It's natural to feel sad when sad things happen. But what happens when sadness becomes pervasive? Could it be depression? What's the difference? Have you ever felt like the word depression is overused or misunderstood? Or maybe you've wondered if you're feeling sad or if it's something more profound. Today, we're exploring depression, what it is, how to prevent it, and what to do about it. As a psychiatrist, I've seen the weight of depression on individuals and families. I've also seen the power of understanding and addressing it. We have to keep challenging the stigma around depression. You might ask, why even have this conversation? Don't the terms sadness and depression mean the same? With so much information available, it's helpful to really understand the difference because this can guide you on how you seek information, reach out for support, and help yourself or someone you love. While there are situations where you can let time and feelings pass, there are also situations where proactively addressing your experience can be life saving. Even a simple understanding of how sadness differs from depression can significantly change the course of your choices. Sadness is a natural response to challenging situations like disappointments, relationship problems, or even loss. Although one might feel down briefly, these feelings typically pass with time. Even when feeling sad, you can generally go about your daily life. There are still moments when you can laugh at a joke, enjoy your hobbies, or spend time with your family or friends. Generally, you can still eat and sleep as usual. Depression is not just about feeling sad. It's a persistent state that affects many aspects of your life. It's an actual mental health condition. For diagnosis, we consider a duration of at least 2 weeks. Again, looking at the whole picture is essential, not just the length of experiences or symptoms. With depression, you find it hard to enjoy the things that you're used to. If you like to read, you're just not up for it, even when it's your favorite book. You might feel constantly exhausted, lacking motivation, and disconnected from people and activities you used to love. For instance, you might find it difficult to get out of bed in the morning or lose interest in hobbies or social activities. When you're depressed, you don't just feel sadness, you also feel guilt, hopelessness, or worthlessness. You might be more easily irritable and frustrated. Compared to sadness, which often has a clear cause or trigger, depression can sometimes have no obvious reason. Symptoms can last long, even after the main trigger or primary cause has passed or is resolved. All relevant information must be considered to truly address depression. When seeing a healthcare professional, I encourage everyone to advocate for quality, not rushed or incomplete care. Depression affects more than emotions. It involves many body functions or physiologies. For example, it significantly impacts cognition, affecting concentration, focus, and memory. Because of the areas of the brain involved in depression, motivation, ability to plan and make decisions, and clarity of thinking are affected. Imagine someone with depression experiencing decreased motivation to eat or drink or neglecting medical conditions like diabetes. This can lead to more negative physiological consequences, creating a cycle that worsens the condition. My husband Carl describes depression as, in quotations, waking up with a heavy, sad feeling, a type of sadness that doesn't lift. It's just there with you. You feel alone, even if people are around you. It's like walking alone in a vast desert. It's hot and there's no water. It's painful and you want it to end. You feel so alone in your thoughts. Most of the time, the thoughts don't make sense. Sometimes your thoughts are just loudly thinking about how to end this sorrowful, heavy feeling. I deeply admire those who share their experiences with depression. Their courage and openness empower and support others, reminding us we're not alone in this struggle. As I listen to their stories, people I work with in clinic, I think about how many times it could have been prevented if it had been addressed earlier, and how helpful it could have been when we feel safe having conversations about mental health with people who are close to us. In preparing for this episode, I looked into what people are saying online about the common myths and misconceptions about depression. I couldn't keep reading for more than 10 minutes because it's heartbreaking to see the list, especially since I've heard them myself too many times as a mental health provider. They've been the same myths over and over since I started this career over a year ago. These are ideas like depression is just feeling sad or that you can snap out of it, that people with depression are lazy, and that it's a sign of weakness. Too many people believe that it's not an actual condition. These ideas are harmful, and the consequences of this ongoing stigma are just too significant to ignore. The stigma surrounding depression can prevent individuals from seeking help, lead to social isolation, and perpetuate misconceptions about the condition. I've taken care of thousands of people with various mental health conditions and many with depression. Some are mild and many are severe. I know and I've seen the many ways depression shows up for individuals. Even in mild cases, each presentation is influenced by a complex dynamic of triggers, life situations, life history, and physiological changes. I've seen a range of the most challenging ways depression affects people. Did you know that in some cases, depression can be severe enough that one stops eating, moving, or talking? Some can have psychotic symptoms where they lose touch with reality, experience paranoia, or have hallucinations. In other situations, people engage in self harm behaviors or sadly attempt or complete suicide. By the time people come to me for medical care, they're usually past the mild stages of their symptoms. I hope that as more mental health information becomes accessible, more people recognize the signs early, or even better, focus their efforts on prevention. Regardless of the severity of depression, help is available. The stigma around depression and other mental health conditions compels me to share what I can in ways that I know how to, because there are ways to help address it. I'm so grateful for all the individuals I've encountered and treated throughout my career. They remind me that this cause is worth standing for. These stigmatized perspectives, yes, they make me sad, but they don't faze me. Once I hear them, I immediately recall the most complex cases I've seen. I feel hopeful, remembering the ways people's lives have changed for the better when depression is treated. In addressing stigma, knowing a bit more about the physiological or body function changes that happen in depression can help. It's not easy to understand what you can't see. When it comes to mental health conditions like depression, the clinical evaluation and treatment rely heavily on how you describe your physical and emotional experience and how you describe how it's impacted the different areas of your life. The observations of a skilled mental health professional, including facial expressions, cadence and volume of speech, the flow of conversation, and other observations also give clues. Mental health providers rely heavily on words and how you convey your story, which could be challenging on its own because most times people with depression might find it hard to describe emotions. Suppose it's the first time you're experiencing depression. That's even harder to make sense of because you don't have past references to draw. It's very different from someone coming in with physical pain and I can clearly see an open wound that needs stitches. But just because I can't see depression doesn't mean it's not real. To put it concretely, you can't see it because the changes are happening in the brain. When someone has high blood pressure, we acknowledge that we have to address the heart and vascular system. When someone has diabetes, it affects different organs of the body, starting with the pancreas. Depression affects the brain, an organ just like the heart and the pancreas. What causes depression? This question often misleads people. Many think it's just life situations, unfortunate circumstances, or bad choices. It's more complex than that. There could be one initial trigger, but I've never seen a case where depression, not just sadness, is influenced by just one thing. It's typically contributed by biological or physiological, psychological, and social or environmental factors. Biological factors could be genetic predisposition, meaning if there is a history of depression in family members, you may be vulnerable. It doesn't mean you'll precisely be like parents or siblings, but you may have your own version based on your unique experiences and physiological makeup. It just requires the perfect combination of factors that triggers the symptoms to show. Medical conditions like neurological problems or hormonal changes, like those from thyroid issues or reproductive issues, can also be primary triggers for a depressive episode. There are lifestyle factors like substance use that significantly influence depressive symptoms. This highlights the importance of getting proper support, including a professional evaluation. Any presentation must consider all the relevant factors. I noticed that medical factors affecting depression are often overlooked. A skilled psychiatrist or medical doctor can help and guide you in addressing pertinent physiological factors if needed. For example, let's say your supervisor gave you feedback about not meeting deadlines at work. You feel sad and the sadness lingers. You wonder, why is this happening? You remember recently noticing that you've been exhausted lately, making it hard to keep up with work. You eventually went to your doctor, and after an evaluation, you learned that you could have sleep apnea. Sleep apnea affects your sleep quality, making you feel tired and sleepy during the day. If untreated, sadness grows as you continue to perform subpar work, causing negative mental chatter to grow. To prevent this from worsening, both sleep apnea and the depression need to be addressed. Psychological factors are usually the ones that catch people's attention regarding depression. Traumatic events, unresolved emotional problems, whether recent or from the past, and even chronic stress from burnout can contribute to the development of depression. High achievers or people with multiple highly demanding responsibilities, like parents, can face unique pressures that increase these feelings. Your thought patterns and personality traits, like being highly self critical, self deprecating, or rigidly perfectionistic, also increase the risk of depression. Many social factors also increase the risk of depression. Examples are relationship problems, death of a loved one, losing a job, money problems, and life transitions trigger depressive symptoms. Regardless of the primary cause, depression impacts all areas, so addressing it comprehensively is crucial. Why do all of these changes happen? If we look at what happens in the brain in depression, the symptoms that show up make more sense. First, let's look at four key areas affected by depression. Number one, amygdala, used in emotional processing. Number two, hippocampus, vital for memory, learning, and emotions. Number three, nucleus accumbens, involved in the brain's reward system. And number four, prefrontal cortex, responsible for planning and making decisions. All of these parts work together to regulate emotions. In depression, these key areas do not function properly. Some are overactive, some are hypoactive, some decrease in size. These changes can cause low motivation, difficulties with coping and managing negative thoughts, ruminations, inability to feel pleasure, or difficulty visualizing a positive outcome, causing feelings of hopelessness. Neurotransmitters like serotonin, norepinephrine, or dopamine are disrupted in depression. These brain messengers help regulate mood, motivation, concentration, and anxiety or excitement. Here's an example of what happens. Dysregulated norepinephrine causes anxiety or panic. Problems with serotonin cause anxiety, ruminations, and lots of gut problems. And low dopamine dampens motivation. All of these can occur, sometimes all at once in depression. And we're just talking about the brain. Your brain communicates with the rest of your body. A stress response can cause inflammation in other organs. For example, if you have eczema and are under emotional stress, your rash will flare up. If you or someone you know has depression, remember in many parts of their experience, many of the symptoms that show up are not by choice. They result from changes in the brain and body. For example, slow movements are not laziness. They could be due to low adrenaline and dopamine. There's just not enough energy and drive to get up and move because of the depression. How can depression be prevented? We can explore this deeply in future episodes, but here's a summary of actionable strategies. It's really helpful to look at our framework of physiology, psychology, and environment to organize some of these techniques. So, number one, physiology. Stay on top of your basic body needs. Have adequate sleep, eat healthily, and engage in movement or exercise. All of these support the regulation of your nervous system. Also, get regular physical, dental, eye, and hearing checkups. Especially as you age, some conditions need to be screened. For example, gut problems must be addressed because gut health is closely tied to mental health. Number two, psychology. Learn and practice essential stress management and coping strategies. Catch negative thought patterns early. Practice thought reframing to counter negative self talk. Address unresolved emotional issues that are limiting your quality of life now. Engage in hobbies that make you feel good and proud of your pursuits and abilities. Number three, environment. Have a healthy support system. Nurture your meaningful relationships and ensure they are safe and caring. If you're in a situation that's not safe or healthy for you, create a plan to change it. If you're experiencing depressive symptoms, here are simple starting points for treating depression. First, remember that acknowledging your experience is an important step. Next, returning to the basics of prevention strategies I mentioned is a good way to start. Get back to the most basic self care strategies like adequate sleep, nutrition, and movement. Engage in an enjoyable activity or hobby. Start with the easiest or what you used to enjoy the most. With consistency, your brain will remember how to feel good again. You must learn ways to regulate your nervous system. Use your favorite calming techniques to rescue yourself from panic or negative spiral. When you're calm, you can think more clearly about the next most helpful thing to do. This can make the difference between harming yourself and reaching for another glass of wine versus interrupting unsafe behaviors and calling a lifeline. What you focus on matters so much. Remember that reaching out for support is a form of self care. Seeking support is not a sign of weakness. Recognizing when one is vulnerable and needs help is an excellent sign of strength. It also feels good to offer help. Remember this if you think it burdens others and are hesitant to reach out. Reaching out or accepting other support is good for you and the other people's brains. Connecting with a mental health professional can be tremendously helpful in identifying the causes of your problems and finding different ways to improve your experiences. This includes identifying medical factors that need to be addressed, learning strategies through psychotherapy, adding medications for those who need them, and changing your lifestyle to support your health. I asked Carl about what helped him manage his depression. He said that one of the most helpful things is the support of others. As one of those people in his support system, being open to support and allowing me to offer help helps me too. Being there for others feels great. If you're feeling stuck, you're not alone or broken. There's help, there's hope. Okay, we have covered so much today. I hope that this episode provided an overview and actionable steps to prevent and address depression. In future episodes, I'll explore deeper into the topics such as medical conditions that contribute to depression and thought strategies for managing emotions. Thanks for spending time with me. Your time is precious, so I really appreciate you. Share this episode with someone who needs to hear it. Next time, we'll explore how burnout impacts mental health, including recognizing early signs of burnout, learning about prevention and recovery. Burnout prevention is a great way to avoid depression. I'll see you next week.